am Dr. Madanki, a fertility expert and consultant gynecologist at CARE IVF, Kolkata. Today I am going to be speaking about IUI or intrauterine insemination. In this video I am going to be explaining what is IUI, how the procedure is done, who are the patients or couple who are likely to require an IUI and why, what is its success rate, and what are the risks and complications associated with this procedure. Let us now speak in more detail about the procedure of IUI or intrauterine insemination. Who requires an IUI? A couple who have been trying to actively get pregnant for the last 12 months and have been sexually active without the use of any contraception is defined as having infertility as per the WHO definition. In these patients, when they approach a physician for investigating for infertility, and if all the parameters in both partners are found to be within normal limits, then it is defined as unexplained infertility. So, patients with unexplained infertility have seen to benefit from having an IUI, which increases the chances of achieving a pregnancy. The next indication is when the woman has mild endometriosis. So, what is endometriosis? When the tissue within the uterus or the endometrium lining is found outside of the uterus in sites such as the peritoneum or the gut or ovaries, then it is called endometriosis, and in these patients IUI has found to make it easier for them to get pregnant. The next indication is when the male partner has been found to have absent sperms in his semen, or azoospermia. In these cases, if the other parameters of the female after investigation is found normal, then they can benefit with the use of donor semen. Also, when there are any genetic abnormalities in the male partner's family or in the partner himself, a donor semen can give a successful chance at IUI for this couple. And one more indication is when a single woman wishes to achieve a pregnancy, she can go for an IUI using a donor semen. One more indication for IUI is when the sperm shows reduced motility, mildly reduced motility. So in such cases, the semen is collected and then when processed and cleaned and washed in the lab, it has been treated with certain agents, the motility is found to be increased significantly, and this increases the chances of pregnancy post IUI. So mildly reduced motility in the semen is also an indication for IUI. Let me now explain the procedure of IUI. A woman, once carefully prepared for IUI, starts taking some medicines from the 3rd day of her cycle for 5 days and then undergoes folliculometry from the 7th or the 8th day. Meanwhile, she is also given some injections depending upon her hormonal parameters to stimulate the formation of follicles. The growth of the follicles is tracked by folliculometry, and when they are mature, an injection is given to help in ovulation or rupturing of this follicle, and then the IUI is timed in such a way so that the semen can be collected from the male partner, washed, cleaned and processed in the lab and then inseminated inside the uterus of the female partner. This significantly improves the chances of pregnancy in the couples which I have mentioned earlier in the video, that is the couples who have an indication for having an IUI. This procedure is called intrauterine insemination. The semen is dropped inside the woman's uterus with the help of a fine cannula, with the woman lying in supine position, and the cannula is passed through the cervix, and most of the times it is usually done under ultrasound guidance. Okay, so let us now know about the success rate of IUI. Depending upon the indication of the couple for which IUI has been recommended and how well the patient has been prepared for the IUI, making sure that all the parameters are suitable and have been tested adequately, the success rate of IUI can be anything between 20 to 25%. We generally recommend at least 3 cycles of IUI, where there can be a much better rate of success in a cumulative manner. So it is very important that the patient has been carefully selected and then adequately prepared based on her hormonal parameters as well as the semen parameters, and depending on that the medicines and the injections are selected. So IUI is definitely a recommended first line management for couples who have not been able to conceive naturally. Now that you are ready for IUI, it is also important to know what to expect during this process. The female partner is asked to inform the clinic on the first day of her period, and she is also prescribed some medicines to start from the third day, and also asked to come to clinic for a baseline monitoring, that is an ultrasound, to ensure that we are ready to start the process. If she has been prescribed any injections, which usually start from the 4th, 5th, 6th day depending on her requirement, and then she is again called to come to the clinic on the 8th or the 9th day to track the growth of the follicles. Once we are satisfied with the growth of the follicles and that they have reached the optimum size and the endometrium lining is also satisfactory, then a trigger injection is given, and then the IUI is timed in such a way so that it can be done post the ovulation, which is also documented as a rupture of the follicle. The male partner is then asked to give a semen on that day, which is then processed in the lab, prepared, and the best part is collected and inseminated into the uterus of the female partner. She is kept in a supine position, and a fine cannula is used to inseminate the uterus with the prepared semen. The procedure is very comfortable, does not require any anesthesia, and apart from a mild cramping, there is nothing really more to be scared of. It is a very safe procedure, and the patient is kept lying down for about half an hour to 40 minutes post the procedure and is allowed to go home after some time. The post-IUI medications that are prescribed are usually in the medicines that would support the pregnancy, so that if a pregnancy does happen in that cycle, these medicines can support. A urine pregnancy test after a prescribed number of days will confirm if the pregnancy is positive or not. You are also allowed to go home and do all sorts of normal routine work apart from those which put pressure on the lower abdomen or any heavy work or any heavy exercises are to be avoided. Apart from that, there is nothing really that IUI is going to prevent you from your routine life. So this procedure is usually the couples are really very happy, because for unexplained infertility and for the other indications, this is the first step where they can expect a pregnancy to happen. The other common question that crops up in couples' minds is, if there is a pregnancy, is the pregnancy going to be any different? Is there going to be any additional risks or complications? Will the delivery be any different from a natural conception? And the answer is no. A pregnancy that is positive following an IUI is the same as it would have been had it been a natural conception, except that we have been monitoring the growth of the follicle and we are able to time the urine pregnancy test or the blood beta HCG becoming positive. Pregnancies that happen following an IUI is the same as it would have been had you conceived naturally, except for the fact that if you had multiple follicles and you end up having twins or even maybe triplets, the pregnancy is going to be the same. As far as delivery is concerned, if you do not have any other pregnancy related complications, even then the mode of delivery is the same as it would have been had it been a natural conception. So there is nothing to fear regarding either pregnancy or delivery post IUI. Even the babies from IUI conception are not known to have any additional risks of any genetic or other complications. They are just as normal as naturally conceived babies. So yes, if there is an indication, you really need not worry or fear and approach us for the next step of your treatment towards achieving a successful pregnancy. If at the end of this video you still have more queries, please do post your comments on the comments box, your suggestions or your queries on the comments box, and I would be very happy to answer them for you. Thank you so much for being with me, and I hope you have had an enlightening video and you have had most of your questions answered. Thank you, Dr. Madanki, Care IVF, Kolkata.